Chana. I'm the chair of the board of Care for the Homeless. Thank you for joining us today as we celebrate the completion of the newest site in the CFH network of healthcare and transitional housing. As many of you know, Care for the Homeless has been operating in New York City for over 37 years with a focus on providing healthcare and shelter to homeless individuals. And we also advocate for policies to end homelessness. Today's opening of the Morris Avenue Safe Haven and Health Center is an important milestone, bringing CFH to 27 sites in New York City. This is something that the board of directors and the CFH organization is very proud of. I actually want to recognize very quickly the board of directors of Care for the Homeless. If you could just raise your hands. Great, thank you. With that, I would like to hand over to our amazing president and CEO, George Nashak. George?
Thank you, Surjit. Welcome to Care Found Here, Morris Avenue. Let me tell you what will be going on here when we fully open this facility. This is a safe haven that will serve 80 street homeless folks. This is a housing first model to move people directly from the street indoors. This is a unique model for us, and I think for the system, because we will also have a co-located on-site federally qualified health center, meaning that we will have compassionate and high-quality social services as well as high-quality health care to help people stabilize and move into permanent housing as quickly as possible. There are many, many doors that we need to help people come in from the street. This is one of them. There are others as well, but a safe haven is one of them, and we think one of the most important ones. So we're very happy to partner with the administration to make this happen. Partnerships really are essential to achieve what we're attempting to do here. We've got an amazing partnership with the Adams administration, with Commissioner Jenkins and his team, who have been essential to helping us start this program. We intend fully to partner with Lincoln Hospital to help them address the issues that they're facing in their hospital and the surrounding neighborhood. We, of course, have a long-term partnership with this will only increase with our friends from Bronx Works. And of course, we feel at Care for the Homeless that it's essential that we partner with the community as well. We want to make certain that we are a part of this community, that we're helping this community improve. And so we commit ourselves to working with members of the community to make certain that this facility is an asset to the program and to the neighborhood. So thank you very much for being here today. I'll tell you a slight personal story. I live in Prospect, Lefferts. And we were ably represented for many, many years at the state by one state senator, Eric Adams. And it's quite moving for me because I feel like one of our hometown guys really made it to the big leagues. And so it's such a pleasure for me to introduce Mayor Eric Adams.
Let's do everyone else, because I want to end up with my man Shams, okay?
Great idea.
Do everyone else.
Okay. So, as I said before, one of our key partnerships is with the Department of Homeless Services. And oh, thank you, Mr. Mayor. How many people can say that? One of our key partnerships is with the Department of Homeless Services. And it really makes me very proud that Commissioner Jenkins and so many members of his senior staff are here with us to open this facility today. It gives me great pleasure to introduce Gary Jenkins.
Thank you, George. And I want to thank Mayor Adams for his commitment to make this city a better, fairer, and more equitable place. As said, I'm Commissioner Gary Jenkins, and it is so wonderful to be here today. I started out as a kid, born and raised in Brooklyn by a single mom with 7 other siblings. I'm the youngest of 8. Growing up, it wasn't easy for my family. I even ended up living in a shelter as a child in Brooklyn at Hotel Granada. This isn't a job for me. It's my life's purpose, because I see myself when I go to shelters. I see so much of myself when I see our clients, because I was a client just like them. And I can tell you, having a place like a safe haven is going to help so many in the community. It's a safe place where unsheltered homeless individuals can get necessary services, food, shelter, and support. So today is a good day, because today we get to introduce 80 beds into a community. Today, we get to help our most vulnerable New Yorkers. Today, we are coming together as a community. Thank you.
So we've spent a fair amount of time engaging with the community as we prepare this program, and there has been no community leader who has been a better partner to us than Council Member Rafael Salamanca. The council member has held our feet to the fire. He has tested our credentials. He has made certain that we are going to produce here services that will do the folks that we serve proud. And that's exactly the kind of partnership that we want. This community is well represented by Councilmember Salamanca, and I'm very pleased to introduce him to you at this time.
Thank you very much. Good afternoon. Buenos dias. I will be brief. First, I wanna thank you for the introduction. And he's right. I did a tour here a few weeks ago, and I had a lot of questions, and they gave me the answers that were necessary. And I will be honest and frank about the situation. Homelessness is real. It's real, not just in my district, but throughout the borough, throughout the city. We see it in our faces every day as we walk through our streets, or we go and drop off our family members. But most importantly, what I've observed is the amount of homelessness that I've seen sleeping in the waiting rooms in the ER in Lincoln Hospital. And quite frankly, it ain't right. It ain't right. And so when I received a call from the administration that they were going to open up another homeless shelter in my district, I had doubts, I had concerns. But when I came here, they showed me their operation, and they showed me that this is not just your regular homeless shelter. This is a safe haven where individuals will have a bed, they will receive medical care, they will receive a meal, but most importantly, they will receive social services so that we can get them back on track and we can get them permanent housing. And so for that reason, I am supportive of this program that's being brought here. Buenos días, mi nombre es Rafael Salamanca Jr., yo soy el concejal de la área. Le quiero dar las gracias al alcalde y a la organización Care for the Homeless por la oportunidad de estar aquí hoy. Ellos están correctos. Homelessness en la ciudad de Nueva York y en el condado del Bronx y en mi distrito es un problema muy grave, muy grande. Cuando nosotros caminamos por las calles, cuando yo estoy llevando el nene mío a la escuela, está ahí. Yo veo a las personas que están en la calle que necesitan ayuda. Pero más que me duele a mí más es ver a las personas que no tienen casa, los homeless, viviendo en el hospital de Lincoln Hospital. Por eso que yo le estoy dando el apoyo. Es apropiado que abran este building aquí mismito para asegurarse que la gente que necesitan las ayudas más lo están recibiendo. Que Dios los bendiga y gracias mucho.
There are many old friends in the room today, and I'm very grateful that you're all here. I've been doing this work a long time, and I have never had the opportunity, and I think a lot of my colleagues would agree with me, to partner with the Health and Hospitals Corporation in quite the way that we are now. We've got a team under Dr. Katz that is really stepping up to change the way they work, to work more in partnership with community-based organizations like Care for the Homeless. We really have wonderful partners in the leadership at the Health and Hospitals Corporation. And we're very proud that the corporation is represented this afternoon by Vice President Matt Siegler. Matt has been a wonderful partner to us, and I introduce him to you.
Thank you so much for having me and for opening up this fantastic facility right across the street from Lincoln Hospital. Lincoln, as many know, is the busiest emergency department in the city, one of the busiest in the entire country. And if you ask any provider there what they would love to have, we add services, add equipment, but if there was a sign out front that said medical care this way, behavioral health care this way, shelter, food, housing this way, that would help deliver care much more efficiently, make things much better for all the providers and the patients we see. And now with a facility like this right across the street, deep partnership between our care teams, the care team here, George, the CEO of this system, and Chris Roker, the CEO at Lincoln, right across the street. It's going to be a fantastic partnership to make sure health and hospitals can continue to deliver the best care for this community and make as many improvements as we can. So thank you so much for the partnership and for having us here today.
So before I give my remarks, Sham, we're going to let Sham come, and I just want to thank both the borough president and the council person here as they continue to deliver for the Bronx. Shams?
I didn't know we were coming to the Bronx. And I gotta be straight up with you. My name is Shams DeBaron, AKA the homeless hero. And I'm not a politician, so if I shed some tears, you know, all right. I used to live right across the street right here, 603 Morris Avenue. I lived in Cortland, Jackson and Melrose Projects, Patterson. I'm from this hood right here. I experienced homelessness, as you know, since the age of 10. 12 years old, permanently discharged into the streets. I remember during Hurricane Gloria. Not having no place to go. I think I was about 12, 13, 14. And I was walking these streets. It was so cold and the wind was blowing. And I was looking for shelter. I couldn't go nowhere. And I was going from building to building. I was so small that the wind was blowing me. There was no resources for me. And it was right here in this neighborhood. And so it's kind of emotional for me to stand before you right here and to see that we have something in our community. And this ain't just anything. This ain't no shelter. This is a facility that I've been begging for. I've been wanting this. A safe haven. A place where people can go get off the streets and be able to come into a safe environment that gives them dignity, that gives them services on site. And oh my goodness, you got Lincoln Hospital across the street. You can't go wrong with this. I'm not going to be long today, but I'll tell you this. Thank you. Thank you from the bottom of my heart for hearing us and for doing something to help us. These are my people out here. And I don't want to see them, like I said before, in the streets, on the subways, or in no damn encampment. I'm not fighting for that. I'm fighting to get people housed. And if it starts with a safe haven, let's make it happen. If it starts with that, let's make it happen. Services. That's what helped me. I'm the guy that was in the streets on the train. I'm the guy that slept in the buildings. But I'm here with all of you today because I was able to get stabilized and to get services that helped me become a more productive member of the society. And we all had that potential. We just need these opportunities. And so I'm grateful to be here among you in my hood. This is my hood right here. And to know that we have resources here in my hood that's going to help people. So thank you. I appreciate you. And one last thing.
Yes, sir.
To all my fellow advocates, trust me when I tell you, we're moving in the right direction. This ain't the same old same. We're dealing with an administration. We have a borough president, our mayor. We have other people here. And they're... I didn't know your story, brother. I didn't know it. I'm telling you, we in safe hands. We're going to make change. We're going to end homelessness in New York City. We're going to show you how to do it for the rest of the world. but it's not going to be easy. And the main thing is we got to work together. So like I said before, I'm here as an advocate, but I'm also here as an ally. Thank you.
Thank you, man. Appreciate you. Solid commentary. You know, I joked this morning when I was speaking with Marsha Clark and said I was the broccoli mayor. You know, because it doesn't taste good, but in the long run, you know, there was a reason Mommy used to say, boy, eat your vegetables. It's hard times. And I think policing has taught me so much. You know, as a cop, I've been yelled at, cursed at, called names, and I just built up this level of, you know what, don't get distracted. And I'm just not going to be distracted. We know we're on the right path. And so people can be critical. You should be, because there's a lack of trust. And I got it. We've normalized this dysfunctional city. We've normalized it. We've normalized people living on the street in cardboard boxes. We walk past them every day. The human psyche has the amazing ability to adapt to any type of condition, and we've adapted in our city to the dysfunctionality of the presence of people not having the proper care they deserve. And so I got it. I know folks are critical. I know folks are saying, well, there goes that popo again, trying to think law enforcement is everything. I got all of that. But at the end of the day, when you finally notice that you're not going to have encampments everywhere, that you're not going to have people on your streets everywhere, you're going to all of a sudden take this broccoli moment and understand that I made us a healthy city. That's what this is about. And my team, like a Gary. So when people say that he's not compassionate, no, my team is made up of people who have gone through a lot. So they're helping people who are going through a lot. That's the difference between my administration and other administration. All of those with high philosophical approaches, I want someone with a PhD of life, of living in a homeless shelter, to be on my team to understand what I'm up against. That is why we're getting the results we're doing. I cannot say this loud and clear enough. People are not going to live under an undignified environment in the city where I'm the mayor. We will do better, and we have to do better. We were not doing better. We threw up our hands and we stated that we could not end homelessness. And I'll be damned if we're not going to try. We're going to give it everything we have. And I want to thank this organization, Care for the Homeless, Lincoln Hospital, the borough president, the councilman, the team that's coming together, that's finally stating we are not just going to push the envelope or kick the can down the road. Morris Avenue, Safe Haven is crucial in stabilization. There's a different type of homeless, of those who are street homeless. I talked with them when I'm on the subway system. I feel their pain. Gary and I have been going unannounced to homeless shelters throughout this city to see firsthand what we're giving to people. You have to examine your product. I probably visited more homeless shelters in my 3 months than folks who have been in this office in 8 years, 9 years, 13 years. On the ground, because generals lead from the front. That's right. They don't send their people into battle and say, how was the war? I'm a front-leading general. And that is what we're going to have to do if we're going to end homelessness. And this facility is an indicator of what's possible. It's a safe space with wrap-around services. What dysfunctional system waits until a street homeless person goes to the emergency room that costs more just to give him medication for a day to have him come back again, over and over again, wasting taxpayers' dollars? over and over. And I have the audacity to come and say, this is not right. Is something wrong with me? This is not about dollars and cents. This is about common sense. We've lost our common sense to govern. You know why? Because the money we spend in government is not the money coming out of the pockets of people who are making these foolish decisions. It's coming out of your pockets as taxpayers. And I'm going to protect your dollars to get a better product for you that you can be proud of to live in a city where we are treating people with the dignity that they deserve. We have to help people in despair. People that look like Gary and his family. As of this week, we are creating 350 of the promised 500 safe havens and stabilization beds. And you know what we're doing? We're creating a brochure. When we go into the subway system, we're going to show the homeless people, we know you have a negative impact of what a homeless shelter look like, but here's a brochure. We're treating them the way people treat me when they want me to stay in their hotel. We're showing them the product and say, if you change your mind and you want to come into a space like this so that you can get out of your head what you believe the congregate shelters were like, we're showing you the product we want to take you with, and we're going to rebuild that trust over and over again. And you know what? We're going to let them come in and see for themselves what the environment looks like. Treat them with the dignity that they deserve. 500 safe haven beds that we're going to bring people in, and we're going to look at those over 2,000 beds that are open.
Come on.
And we never put people in.
Come on.
Sometimes I feel like this is a comedy show. But it's so serious that you can't laugh at this dysfunctionality and this betrayal of New Yorkers. And so when I released the subway safety plan, I said something very simple. Too long we have treated these New Yorkers as unseen. We're not going to allow that to continue to happen. We're not going to abandon homeless people in our city. We're going to give them the support, the housing, and the healing that they deserve. And this is an indicator of what's possible, and it's the beginning of what we're going to do. And so I understand the naysayers. I understand the critics. I understand the people who said it's not possible. I understand that people don't believe trust. I understand that people have a feeling of abandonment. I got it. But I know that there are a team of people like in this room who are committed to homelessness. They're committed to the work they're doing, and they have a partner in this mayor. We are going to address this issue like we're going to address gun violence, like we're going to address the failure of education, like we're going to address the dysfunctionality of nutritional issues that's feeding our healthcare crisis, like we're going to address our housing crisis. We're going to tackle it head on. And while we're doing it, it's going to be a little uncomfortable for folks. But at the end of the journey, we're going to get the product that we deserve as New Yorkers. Your tax dollars deserve more. And I'm going to make sure we get the product that you paid for. And so I thank this organization. I thank my partners that are here in government. And we're going to do a series of things together. I have been in the Bronx how many times? You know, I think by now I earned my BX. You know, and I'm going to continue to be up here. This borough has been denied for far too long. And I'm going to spend time here in this borough because if we lift up the Bronx, we can lift up every other borough in this city. And so I'm proud to be here and cut this ribbon and say congratulations to not only the organizations, all of you who are here who work in this space, but to those men and women who are going to benefit from the love, the nurturing care that they deserve. You can't get this on the A train overnight. You can't get this sleeping in Times Square. You can't get this sleeping in a cardboard box. You can't get this sleeping in a tree in a park. You don't deserve that. You deserve this. We're open to any questions. Kate?
We're gonna go to cut the ribbon, I think, first, and then we'll do some questions.
Yes.
Okay?
Yeah.
I gotta come. I gotta see this. I gotta be right here.
Hold on, they gonna do those three. Stand up. Okay. Hold on. Let them get their shot.
Tell me when to go.
1, 2, 3. Go ahead, do it again. You're gonna do a lot of rhythm touches.
Okay, yeah. There you go.
Thank you.
Mr. Mayor. You said that you visited many homeless congregate settings throughout your first 3 months. Wondering how many locations have you visited within your first 3 months in office? And then also on the homelessness encampments, you said that you have an announcement tomorrow, but wondering, in the first 11 days, how many people have you removed from these encampments and connected to services?
Tomorrow we'll be going over those exact numbers. So all I could do is do like they did on Batman. Stay tuned. And I visited 5 shelters and 1 in each borough to get an idea of what's going on.
David, go.
Hi, Mr. Mayor.
How are you?
So the contract for this safe haven was first awarded in 2020. It's just opening now. How are you going to streamline these types of openings to meet the need and get those additional 150 sites open?
Great question. I don't know what previous administrations used for their 3 letters, but my 3 letters are simple. Get stuff done. Get stuff done. We're going to get it done. A delay in another place is not going to be a delay in this administration. We're going to get stuff done.
Well, how are you going to counter the type of community backlash to safe havens that you're seeing elsewhere in the city?
Well, number one, 8.8 million people, 30 million opinions, but one mayor. I'm the mayor, and I'm going to put places that I need them, and everyone is going to share the housing crisis. We have oversaturated certain communities, and that is not going to be under my administration. We all will share the housing crisis.
Michael?
Always good seeing you, Michael.
It's good to see you too, Mr. Mayor. I was speaking with somebody with the Coalition for the Homeless yesterday who said that the city needs more safe haven beds. You promised 500. She was saying 3,000. I think you mentioned before, unused supportive housing, right? And the prospect of using that, which conceivably would open up safe haven beds. Could you, I guess, kind of address those concerns that this person from Coalition expressed to me and just kind of lay out how this is going to work as far as the puzzle with supportive housing?
We're going to fill the 500, and we're going to continue to build based on the need. I'm a big believer in retrofitting and changing hotels into housing. We could also do so for safe haven beds. Right. And so we're going to continue to identify the need and fulfill the need. And of course, we're dealing with financial crises as well. We have a real budget issue, and we all know that. But I believe if we streamline, if we become more efficient, and we stop wasting taxpayers' dollars, we will have more than enough to provide the services to the people of this city.
You also, I gotta ask about this.
You've
got the broccoli moment. The broccoli moment here. How long do you envision the city going through this broccoli moment?
Well, Mom said you should eat broccoli your entire life. I'm plant-based. I mean more broccoli now than ever. We have to constantly inspect ourselves. That's what happens. We rest on a success of one thing. We must be in a perpetual state of reevaluating ourselves. Are we meeting our targets and our expectations? Not to fall back. We made that mistake during the Comstat era. Comstat should have continued to evolve in law enforcement, and it didn't evolve because we felt we were successful, so we can rest on what we were doing. We can't. We evolve as human beings. Cities evolve. Private industry evolves. It's time for government to have that evolution. So we are never going to lead the broccoli moment. We're going to always be evolving.
All right, we have time for one more. Yeah, go ahead.
You say there's 350 beds that are going to be launched this week. Besides just the 80 here, where are the rest going to be? And when you guys are looking at clearing out homeless encampments, what next areas are you guys going to be targeting?
I'm sorry. Okay, first let me answer the bed. We'll give you the exact location to all of the beds. A total of 350. A total of 350 out of the 500 that we have reached. Gary will get that information to you. Okay. And now I understand the second part. Your second question.
When you guys are clearing out homeless encampments over the next 2 weeks, what are some of the other big areas that you guys will be targeting? I know yesterday was the underneath the expressway. What other areas are you guys going to be targeting next?
Well, we'll announce all that tomorrow. As I say in my Batman moment, stay tuned. Okay, we're gonna do off topic so you guys can bounce so you don't get caught up in the crossfire of off topic. Whenever you see Michael here, you know something is going on.
Mr. Mayor, another question for you.
Yes.
So you mentioned that you're very concerned with the 2,000 additional open apartments, and you said you have a plan. What is that plan? And again, that's a really high number. What is the city doing to actively fill those beds amidst all these other plans that are announced?
Well, first of all, I wake up every day and read the paper. And some of my best ideas come from some of the good reporting in the city. And, when this was placed on my radar, I immediately kicked into action, and we're going to roll out a formal plan of filling those beds. We're gonna roll out and show you how we're going to accomplish it, that I'm going to be very much engaged in, just as I'm engaged in the cleanup of the encampments. And so in the next few days, we're going to roll out that plan.
Start, and how long do you envision that process will take of filling the 2,000 empty apartments?
Should not take as long as it has taken. And so this is something that has been brought to my attention, and I'm going to fix it. And when we roll out the plan, we'll give you an exact timetable.
Cool. Go ahead.
We reported last week about some subpoenas issued by the Southern District regarding Lieutenant Governor Brian Benjamin. What are your thoughts on this? I mean, you used to be in the state senate. This is stuff having to do with his time in the state senate, it appears, with disbursements taken from state funding. And also, if you could, from your perspective, what implications might this have on the governor's race, which is looking increasingly likely former Governor Cuomo might throw in on?
I don't have any views on it. Prosecutors would do their job. I think they would make the determination if any wrongdoing. The mere fact inquiries are made, that's not an indicator of wrongdoing. And let's let the prosecutors do their job.
All right, we have time for one more. Go ahead, Emily.
Hi, Mayor Adams. How are y'all with that here?
Yes, yes.
You were out last night, I think, at One Vanderbilt with some celebrities at a
Yes.
pretty poppin' party, it looked like.
I love the summit.
Are you worried about the optics of that, contrasting with, say, the clearing of the homeless encampments? Are you worried, or how could you speak to how that helps improve the city, how it reopens the city, supports the city's economy?
Okay, first of all, we need a level of accuracy. I was not just at the summit. I was at a Broadway opening. I also went to a few restaurants that I popped into. I walked the street. I was in the subway system last night. My belief, if you're going to hang out with the boys, you got to get up with the men. I was up early this morning doing my job. I have to get the city up and operating. While I deal with the homeless crisis, I must deal with my economy that can't create homelessness because we don't have people back to work. We have the largest unemployment numbers. We're leading the nation. That's unacceptable for me. And nightlife, believe it or not, is a multi-billion-dollar industry. And when they see their mayor out enjoying our city, it sends the right message and the right signal. And I can multitask. This is the city of New York. I'm not drinking out of a garden hose. I'm drinking out of a fire hose. And I can handle every drop of the water because I'm made for this moment.